Most people have been to their GP with a sore throat, runny nose, or frustrating cough, and many have asked for antibiotics. But should they be given? Hi, I'm Dr. Kane Treble. This one's a common problem and a question I get asked a lot by my patients. A person will come in with a cold, earache, tonsillitis or sinusitis, collectively known as an upper respiratory tract infection, or an URTI as I'll be saying from this point forward, because it's a lot easier to say than an upper respiratory tract infection. Anyway, they'll come in and they'll ask for antibiotics to try and make their symptoms better. First thing first, most URTIs are caused by viruses, which means giving antibiotics will not work. It's like trying to put a square peg into a round hole. Antibiotics target parts of bacteria which viruses simply don't have. Antibiotics will, however, affect the really important balance of bacteria that are found normally in your bowels and other body parts, meaning you might end up with nausea, abdominal pain or cramps, and diarrhea, which can be even worse than the URTI itself. Or a rash from the medications, or worse still, a life-threatening allergic reaction which can result in death. It's rare, but it does happen, and just because it hasn't happened to you before doesn't mean it never will. But what if your illness is caused by bacteria? Well, antibiotics are used for three main reasons in bacterial URTIs. First is to speed recovery, but we now have a lot of studies showing that antibiotics don't really do this well, or at most reduce symptoms by about half a day, but carry all the risks as mentioned before. Secondly, antibiotics may be used to reduce symptoms, but again we now have multiple studies which show that antibiotics only really do this in some but not all ear infections, and any benefit is probably placebo or just natural course of the infection. And finally, three, to prevent more sinister complications like abscess formation, which again we now know antibiotics don't really change the rates of. So when should we use antibiotics? Doctors are more likely to treat those under 2 or those over 65 years old, those with impaired immune systems, or if there's significant other medical health conditions, or if there's a special risk score that finds out you would be an at-risk person suggesting that we should. Now, you might say, I know the effect is just in my head, but I want the antibiotics anyway, and fair enough. But there is a more sinister side to this story. Antibiotic resistance, meaning bacteria working out ways around the antibiotics to continue to infect and make people sick, is a significant concern. We've forgotten what the world was like before antibiotics, and if we don't try and prevent antibiotic resistance through overuse, we're going to return to that time, so that life-threatening infections might be untreatable. By not using antibiotics for comfort now, you might be literally saving the life of your children or your children's children. And as a father myself, I'm willing to put up with a sore throat for that. So what can you do? Well, most URTIs will resolve normally within anywhere between 4 days to 3 weeks, depending on the type and exactly where the infection is. And I get it, it sucks. But rest, keeping hydrated, regular paracetamol or ibuprofen, or an appropriate anti-inflammatory if it's safe for you to take it, along with time, and eventually most URTIs will resolve. A spoon of honey at night has actually been shown by several studies to be even better than most medications in soothing sore throat and cough at night, so give that a try. Thanks for joining me today. This channel will be releasing regular health tips and tricks, so if you like this video, hit the bell and subscribe, click to be notified of our next upload, and let me know if you'd want antibiotics for your next URTI in the comments below. I'm Dr. Kane Treble, and this has been another long consult. Catch you next time.